everyone, and welcome to this informative discussion on the management of atopic dermatitis. I am Dr. Harshita, your host, and we are privileged to have Dr. Marwa Saeed with us today. Dr. Marwa is a distinguished dermatology specialist at Cairo Hospital of Dermatology in Egypt and Al Amidi Hospital in Qatar. With a master's degree in dermatology and over a decade of experience, Dr. Marwa has a keen interest in the field of pediatric dermatology too. Welcome, Dr. Marwa, and thank you for joining us today.
I'm very happy to be with you.
Thank you, Doctor. So, to start our conversation, Dr. Marwa, could you tell us about the most commonly prescribed topical treatments for atopic dermatitis and how do they help in symptom relief and long-term management?
The most common topical treatment to use for atopic dermatitis, or we can say the first line of treatment, is topical corticosteroid. According to the case is severe or moderate or mild, usually we start in mild cases with the low potency corticosteroid. It relieves the inflammation of the skin lesion and also the itchiness. And most cases can be treated by this topical first line. And if need more, we can go further for the second line is topical immunomodulator like calcineurin inhibitor. Also, there is other topical treatment like topical phosphodiesterase inhibitor with crispirol and other new treatment topically JAK inhibitor.
Yeah, thank you, Dr. Marwa, for clarifying the role of these topical treatments. And it's clear how important they are for both symptom relief and long-term care. Now, moving ahead, could you discuss the role of immunomodulators in managing atopic dermatitis and their effectiveness in controlling the disease?
Yeah, sure. As I said, now we have topical immunomodulator. Okay, this topical immunomodulator is the calcineurin inhibitor, tacrolimus and bicrolimus. The mode of action is as immunomodulator. They are not corticosteroids, so they can decrease the inflammation of the skin without the side effect of steroids. Like no atrophy, no telangiectasia, no erythema, or no rebound after stoppage of this immunomodulator. The only side effect you can find it at the start of the treatment is the burning sensation or stinging sensation. Usually, we advise the patient to use it twice per day or once at night, according to the tolerance of the patient. And the patient can put the cream or ointment, usually it's an ointment base, in the fridge to be a little bit cold when used, not to cause any irritation. This topical calcineurin inhibitor can be used alone as a monotherapy or as a combination with corticosteroids. Also, it can be used as a maintenance. The most important thing in this calcineurin inhibitor is it's very effective and a very good option for around eyes or around mouth, any skin disease, not only atopic dermatitis.
Now, let's delve into systemic therapies. When it is appropriate to consider oral medications or biologics for atopic dermatitis, and what are the potential benefits and risks?
Yes, if the patient not controlled on the atopic dermatitis topical treatment, we can consider using the systemic treatment. First systemic treatment we can use in the acute exacerbation is short courses of corticosteroid, but it has some side effect from rebound, so we don't recommend that too much. And another systemic treatment we can use antihistamine to relieve the itchiness or mainly to induce sleepiness for the kids to can sleep at night. Other systemic or main systemic treatment now is the biological treatment. The main biological treatment now is the Bulimab, which is interleukin-4 monoclonal antibodies. Interleukin-4 has a main role in the immunopathogenesis of atopy. So when we block this interleukin, we can treat the atopic dermatitis. It's taken in subcutaneous injection. According to the age and the body weight of the patient, can choose 200 milligram or 300 milligram, and the frequency to be every 2 weeks or every 4 weeks. There is no side effect. There's no serious side effect, only very minimal side effect like injection site reaction, which is the pain. and we can control it by take the injection out of the fridge for 60 minutes or 45 minutes with slow injection. And another side effect is conjunctivitis, which is mostly from the atopy itself, not as exacerbation from the disease, and we can send the patient to the ophthalmo doctor to manage it. Other rare side effects, including eosinophilia, more with asthma, and arthritis or arthralgia is very rare, and this psoriasis-like reaction is also very rare. Other not biological treatment, systemic treatment is the JAK inhibitor. The good thing in JAK inhibitor, we can use it if biological treatment is failed in moderate and severe atopic dermatitis. JAK inhibitor induce rapid response to the atopy, and it is in the oral form. We have a JAK inhibitor, abrocitinib, which is oral JAK inhibitor. This is JAK inhibitor one only, selective. It can be taken in oral form, 100 milligram or 200 milligram. It is approved from FDA from Europe and USA. And in general, like the JAK inhibitor, only the side effect of reactivation of the some infection, and this is not common. Another JAK inhibitor is upadacitinib. It is the JAK1 inhibitor also. It can be taken from age of 12-year-old in oral form. The dose is 15 milligram. Maybe we can increase it to the 30 milligram. The last one is the baricitinib, which is approved only for adult patients. JAK inhibitor in the oral form. From the dose, it can be taken 2 milligram, or we can increase it to the 4 milligram.
Thank you, doctor, for your comprehensive explanation. Now, moving ahead, are combination therapies involving both topical and systemic treatments commonly used for severe atopic dermatitis? And what considerations guide these treatment choices?
The combination, sure, any systemic treatment, we should give time to the systemic treatment to work. So we combine with topical treatment, especially with biological, dupilumab. Dupilumab takes time, actually about 2 weeks to 1 month to give its result in the skin lesion relief. But in the itchiness, it gives rapid response. So usually for our patient, we advise them to use the topical treatment, which is topical steroid, topical calcineurin inhibitors. Usually it will be used for less frequency like than before. And this combination will give the patient trust to the treatment, and it will give the patient time to maintain later on. So sure, we do combination, yeah.
Yeah, and how do you recommend monitoring patients with atopic dermatitis over time? Like, how do you determine treatment success or the need for adjustments?
The success according to the patient satisfaction. Some patient has only problem in itchiness and doesn't care about the skin lesion, especially the adult patient. They complain too much. I cannot sleep well. I cannot do my work from itchiness. Patient satisfaction is the most important factor, and our examination to the patient to see how it is the improvement according to the first symptoms or now symptoms, how it is. But usually depends on the compliance of the patient to the treatment and to their satisfaction.
Now, to help prevent atopic dermatitis exacerbation, so what advice do you give to patients regarding allergen avoidance and lifestyle modifications?
Yeah, this answer to the question will be a little bit long because we need to explain what is atopic dermatitis. Atopic dermatitis is a multifactorial disease. The main two factors is immunopathogenesis and the barrier function disruption. Okay, this immunopathogenesis not only for the atopy, it can be also affect food allergy or environmental allergy. And environmental allergy can, with the disrupted skin, it can induce more and more immuno But actually, in atopic dermatitis, the environmental factor is a cofactor, not a cause of the disease. So many patients had a pollen allergy, had dust mite allergy. This cause exacerbation of the disease, not the main cause of the disease. So we advise patients if they have this allergy, if we did this allergy test and we find them have this allergy, they should avoid. And for the food allergy, also the same. About 50% of the children having atopic dermatitis have high degree of IgE for some food, and they have food allergy. But avoidance can decrease the exacerbation, but cannot affect the general outcome of the disease for curance.
Yeah, and now coming to our last question. In selecting over-the-counter products for managing atopic dermatitis, such as moisturizers or emollients, how do you guide patients in making suitable choices?
Yeah, the atopic dermatitis, as we said, the main factor is the skin disruption, the skin barrier disruption. This is genetically, the patient has a defect in the longer chain fatty acid ceramide, so they should, this ceramide not present, so we should give another cream containing this ceramide, because this defect also induces the immune response, and we come in the vicious circle, activating immune, activating disruption, and so on. The moisturizer, the patient should choose some formula with ceramide. Better to be an ointment formula, greasy. But the problem, some patients don't like this greasing sensation all over the day. So if patient doesn't like this formulation, we can advise him to use the cream or even lotion to maintain as can as possible. He should use it at least twice per day. For my patient, I advise them to use 5 times per day to be fully corrected. And actually, patients will use like 4-3 if you advise 5 times. And what's more, the moisturizer can be put on the skin with the skin, not the dry skin, to keep the water inside. And also, we advise patients to take baths for kids, for children, once or twice per day. This is good for their hydration of the skin. For adults, it's okay. You can take it once per day. It will be also good.
Yeah, thank you, Dr. Marwa. We have had an incredibly enlightening session today. And thank you once again for joining and for sharing your expertise and insights. And a huge thank you to our audience for tuning in. And before we conclude, I want to bring your attention to the MedSynapse platform, our vibrant hub that's redefining the healthcare landscape. It serves as an invaluable resource for professional doctors like you, offering opportunities to engage in meaningful discussions, connect with expert doctors, and be part of advancements in healthcare. Why wait? Explore the MedSynapse platform right now to make the most of these remarkable opportunities. Feel free to drop your comments in the section below if you have any questions. We'll be more than happy to provide you with the answer you seek. Until next time, take care and keep advancing in your medical journey. Goodbye.